treatment as prevention, in a nutshell, simply, the new science on HIV tells us that when you start people on treatment and treat them fully so that the level of the virus in their blood is suppressed to an undetectable level, then the chance of them transmitting the virus to somebody else is dramatically reduced. So essentially, we're no longer just relying on behavior change. We're no longer just relying on our prevention of mother-to-child transmission programs and people using condoms or people abstaining. We also now have this new super tool in our arsenal to help us reduce the infectiousness of people who are living with HIV. They stay healthy, and the public health benefit is that we dramatically reduce infections. And this is the new tool that gives us the possibility of ending the AIDS epidemic. People may continue to get infected, but we have what it takes to ensure that really people are not dying of AIDS. So the Sustainable Development Goals, of course, there's a focus on health, and one of the targets under there relates to HIV and other diseases, and the mandate right now is to end the epidemic by 2030 using the tools we have in our arsenal, not just the biomedical tools, but taking into consideration that treatment as prevention is a game changer that gives us a greater possibility of ending the epidemic. Last year, the Community of Nations came together and committed to a political declaration on ending AIDS. And that means that they've all said we're going to enforce a fast-track strategy to ensure that from now until 2020, we scale up HIV services. We use this information, we use these tools to ensure that people have the HIV services they need and we get the prevention goals that we're looking for. So you're going to hear a lot about 90-90-90, and just quickly, what that is a treatment target of that fast-track strategy. And what we're aiming for is by 2020 to have 90% of people living with HIV aware of their status, so tested, 90% of people who are tested positive on treatment, and then 90% of those people achieving that gold standard of viral suppression. So where are we in the Caribbean? These numbers are based on our 2016 estimates. As I said before, our global AIDS report is going to be launched next month, so we'll have the updated numbers. So these figures are actually 2015. 3 of every 5 people living with HIV in the Caribbean know their status. The numbers vary from country to country. This is the average. Just about half of people who are living with HIV on treatment, and about a quarter of them have achieved viral suppression. So we have lots of work to do in order to reach those 90-90 targets and have a chance of ending the epidemic by 2030. So, the question is really not just how do we sustain our HIV responses, but where is all this additional money going to come from when we talk about scaling up services? I wanted to give a quick snapshot about the external resource picture. Where's the money coming from? How's the money being spent right now? So this is 2016. We know that Global Fund and PEPFAR are our main partners. You can see that a lion's share of money has been going to Haiti, to the Dominican Republic, in the case of the Global Fund, to Cuba, and smaller proportions going to some of the English-speaking countries. But now the focus is very much on key populations, on human rights, on stigma and discrimination, ensuring that the people that are hardest to reach have access to services, and also that the Caribbean countries make that transition to using treatment as prevention by offering treatment to people right away. So those are the areas of focus. In terms of the Global Fund, there's lots of dialogue in the Caribbean about the eligibility criteria, and really what they're saying is we're focusing on countries with the highest disease burden and the lowest economic capacity to deal with this. So you could go onto their website and pull up the table to look at how countries are classified in terms of economic status and what kind of funding they're eligible for based on that. And you'll find that several countries in the Caribbean just are no longer eligible for funding. So right now, the Global Fund has programs in Belize, Cuba, the DR, Guyana, Haiti, Jamaica, and Suriname. And they also have regional grants, as I said before, focused very much on human rights, stigma, and discrimination, and reaching key populations. There's one with CARICOM, there's one with the Caribbean Vulnerable Communities Organization, and there's also a sub-regional grant for the Eastern Caribbean. So for PEPFAR, and I'm focusing here on the English-speaking countries because there's a Haiti program, there's a Dominican Republic program, but I think, the stories that have rung alarms and gotten everybody to pay attention really have to do with PEPFAR and the way they're progressing in terms of the English-speaking Caribbean. And again, it's the same principle of them looking at which countries have the greatest disease burden, which countries have the greatest need, and where they could achieve the most impact. And for the English-speaking Caribbean, that country is Jamaica. So the lion's share of resources are going to Jamaica. It's because they have the highest HIV burden in the sub-region, highest number of new infections, highest number of deaths, and one of the lowest treatment coverage rates. So last year, that was 37%. So there's lots of work to do in Jamaica. And what happens to the other countries? Well, in the Bahamas, PEPFAR programs closing out this year, Barbados in 2018, Suriname, Trinidad and Tobago, and Guyana in 2019. So what do we do? I wanted to share 3 priorities for Caribbean countries as we move forward at this juncture, taking into account that we're not just talking about sustaining our programs, we're also talking about scaling up service access by 2020. The first thing is transition planning. We've been talking for a few years, and the Caribbean has been working on its sustainability planning for some time. The important thing to say is that all the donors aren't leaving right away, but we have this window of opportunity to plan together. And
I'm on conference, but I can hear it's here.
I think Janine's mic is muted. We have to look at various aspects of sustainability. So obviously financial sustainability. Do countries have stable funding mechanisms in place? Epidemiological sustainability. Are countries doing what they need to do? Are countries reaching the communities they need to reach? Are their strategies working to lower new infections and deaths? That downward trajectory is the only way our response is going to be sustainable. Political sustainability. Is AIDS on the policy agenda? Does it remain a priority? Is there political will to keep addressing the issues surrounding HIV? Some of the structural issues that Abby mentioned at the start of our discussion here. We need to continue to build an enabling environment for the HIV response. We know how HIV vulnerability connects to gender-based violence, to poverty, to inequity. So what work are we doing to ensure that our HIV program has the most enabling context possible to achieve optimal results? Human rights, and this is critical because we know that Global Fund and PEPFAR are really prioritizing human rights and prioritizing key populations. When they leave, what's going to be in place to ensure right to health for key and vulnerable populations, and that they have access to services? And then finally, programmatic sustainability. Which elements of our HIV service delivery can be integrated into primary health care so that they're no longer the standalone services that we've been used to in the past, because there simply isn't the money for it anymore. So there's work ongoing right now in the region to ensure that we assess where countries are with respect to each of these components. Jamaica has been first out the block. They've done their transition plan already. And we have several countries that are supposed to conduct their sustainability/transition plans this year: Guyana, Suriname, Trinidad and Tobago, Barbados, Belize, and the Eastern Caribbean. So this is a priority. PEPFAR, Global Fund, UNAIDS supporting with the help of some other development partners. And it's so important to ensure that we have the voices of communities involved and to ensure that we're not just talking about money, but we're talking about human rights, we're talking about the social issues, and we are preparing every dimension of our response to be off and running when our international partners leave us on our own. Then there's a question of efficiency. Now more than ever, we have to get a big bang for our HIV buck. We have to spend money and make sure we get the greatest impact and ensure that we're spending it in the most efficient way. And there are various aspects of efficiency, procurement, mechanism, supply chain management, I mentioned before, integration. But what I wanted to focus on here in particular was the need for greater community involvement. And one of the things that we've realized as our HIV responses have matured is that civil society organizations are often better placed to provide services, particularly for those populations that are hardest to reach. And we're talking here about people who are marginalized and vulnerable on the basis of sexual orientation. Maybe they're migrants, maybe they're sex workers, maybe they're sex workers and migrants, homeless people, people in prisons, people who use drugs. So we have to ensure that when the international partners leave, that there's domestic funding to sustain these programs. We have to ensure that our community organizations are providing quality services, and we have to ensure that the mechanisms are in place to allow for that government support for these services to continue. So it's really important that that is a priority very, very soon. And then the final thing, the bottom line is that countries are going to have to spend more. They're going to have to pay, not just for doing the usual, but for scaling up. Testing, for treatment, for viral load testing into the future, now and into the future. So if you take a look at this table, it shows country by country what the investments are in terms of domestic funds as opposed to foreign funds. Haiti is on one end of the ladder, but we're really immediately concerned with the upper and middle income countries that are going to be responsible for a larger portion of the HIV responses in short order. The solutions and the answers are going to vary from country to country. As part of this dialogue, people have floated different ideas: a sin tax, or a tourism tax, or a fund for health as a whole, as opposed to HIV specifically. Each country needs to look at its economic situation, needs to look at what fiscal space it does have, needs to look at what innovations might apply so that they can come up with the money to allocate to ensuring that we not just sustain, but keep emphasizing, scale up the HIV services so that we have a shot in the Caribbean of ending AIDS by 2030. So I'll end here and open the floor for conversation and questions.
Cedrian, thank you so very much for taking the time to walk us through this. Very interesting data and setting the context for where we are and the challenges going forward. I appreciate you taking the time on that. So if there are any questions that we have,
Hello? Can you hear me? Hello?
Yes, we could hear whoever was speaking.
Oh, yes, this is Otilia. This is Otilia St. Charles from UNAIDS. Again, thank you for this this forum. It's very exciting. It's a very exciting prospect for the public health agenda in the region. I just wanted to add just a couple of notes to what Cedrienne presented that might be useful to other people on this call. She made reference to key populations. There have been some recent shifts in the way we're approaching the HIV epidemic in the region. One of them she spoke about, which is treatment as prevention. She also talked about the increased focus on key populations. And within the context of HIV, when we're talking about key populations, we're referring specifically to persons living with HIV, gay men and other men who have sex with men, transgendered people, and sex workers. We also refer to young people within those particular populations, and young people in general as a vulnerable population, but not necessarily a key population. I thought that was an important distinction to be made. And then also making a link between the presentation that was given by Abby, where she made reference to the Public Health 3.0 model. Within the context of HIV and in the way that we approach it, that model translates into what we call combination prevention. And that's something that we definitely promote, and what you'll notice is being implemented in the region. And when we say combination prevention, we're talking about targeted and strategic interventions that are implemented at multiple levels, at the societal level, at the policy program level, at the community level, and at the family and individual levels. Oh, that's all for now.
And just to acknowledge that a few of my co-workers are on the line and stand ready to help answer any questions people have and to engage in the dialogue. Brian, we can't hear you.
Okay, here we go. Is that better? Yes. So thanks to all the UNAIDS folks who are on the call. And so I appreciate the context that you gave. I do have a question around key populations. So have you guys seen any information around the region on the prison population or the returning citizens population from prison and what those rates look like? Because there's a question that I've had and I haven't seen any data on my end, at least, around what the stats look like for that population. And are they deserving of also being a key population if that data exists?
So some countries, very few countries, have reported on prison populations. One I could remember is Jamaica. The last study found a rate of 8% among people in prisons. One of the challenges we have is countries monitoring what's happening with their key populations. They know what's happening with young people generally, with men and women, but what's happening with men who have sex with men, with sex workers. Transgender people, almost no data. Guyana is one of the few countries that has been doing a good job of tracking the epidemic among its transgender population. So, you know, we think it's a huge issue, but really we need countries to prioritize monitoring the epidemic among all of these communities. And that's one of the areas that the Caribbean really needs to improve.
Mm-hmm.
I really appreciate the feedback because I've asked that question, at least in Barbados, and the data was not available. And so the only study that was reported to me or referenced was, I think it was Dominica, where they looked at the prison population and found that there was no significant issue. But I know firsthand that there's how should I say this? Within the prison population and even our mental health facility in Barbados, I know that those are challenges that we faced for years, but it's something that we kind of don't really address publicly. And so I think and not that the folks who work there don't want to engage, but it hasn't been a systemic conversation for the public health system. And so I think those types of studies, as we get into this transition planning for countries, I think those are important questions because, again, we're very small demographic. And so if we're missing some of these target and key populations, the impact across the country can be, very significant. So I appreciate the context on what these target or who these target populations are.
Mm-hmm. Yeah.
Hello?
Yes, go right on ahead.
Yeah, I just wanted to make a comment. I think that the point that you raised, Ryan, is a very relevant point. But I think that there's often a challenge for countries where they have to a limited amount of funds, and then they have to prioritize exactly how they're going to utilize those funds. And then you also have the mandate of donor organizations to address particular populations. So there's a lot of onus put upon decision makers at the national level to set their priorities and to budget to support those priorities. So I think that while the prison population may be a very important population, from a global perspective, there are key populations for which evidence has been generated, and therefore funding has been substantiated.
Yeah.
So, so this goes back to the point that just Adrienne was making about the necessity of local governments to prioritize budgeting beyond what donors make available to them to actually address local priorities.
Yeah.
So we're at a critical juncture in the HIV epidemic, or response rather, where those critical decisions need to be done and the political commitment needs to be made to really take a serious look at what we know is going on in countries and to put money towards generating the evidence to substantiate interventions in those areas. Right now, what we know is, like Adrienne said, that those key populations that we listed are priority, but in some countries, because they opted to prioritize special studies in the prison populations, they're able to actually rationalize mobilizing resources for those populations. But again, that need is still there, because even when you look at the key populations that we're focusing on, that population and the prison population are not mutually exclusive.
Yeah.
Exactly. Thank you. Thanks for the context.
So, and I have a question as I think about, as many of us who are on the line may not live in the Caribbean, we're concerned about the Caribbean. Some of us are living in the Caribbean. But I know that UNAIDS was involved and continues to be involved in changing engaging in supporting advocacy to address some of the legislative pieces that are on the books across the Caribbean that further contribute to the stigmatization of men who have sex with men, transgendered persons, sex workers, etc. How can we, as concerned Caribbean people, engage and support UNAIDS in your work from a public health standpoint to address these populations and ensure that stigma is reduced in our countries?
Thanks, Abby. Actually, UNDP and the Pan-Caribbean Partnership Against AIDS last month, or was it earlier this month, had a conference for parliamentarians here in Kingston where they were engaging parliamentarians from both sides of the political divide in several of the countries on this legislative agenda. And, the call is for, on the one hand, protective laws. So laws that protect people from discrimination on the basis of HIV status, sexual orientation, gender identity. And we think that's something that should be low-hanging fruit, something that should be relatively easy and accessible for countries to accomplish. We've done some public opinion polls in 6 Caribbean countries that have shown that people have no objection to offering protection for communities that are vulnerable for these particular reasons. So that's one thing. On the other end of the issue, the question of removing discriminatory laws, some of them colonial era laws, long-standing, relating to anal sex or sex between people of the same sex, relating to sex work. The criminality we know makes people afraid, drives them underground, makes them feel as though I don't have access to justice, I don't have access to healthcare, I have to remain hidden, I have to remain clandestine. And so changing the laws is not a magic bullet, but it's a first step in creating an environment where people feel empowered, where people feel protected, and that they're able to access all of these services that we already provide. So, you know, that's a longer term goal in terms of Caribbean government. You know, we know the reality of politics, and we know that one of the terms I've actually heard a politician use in an AIDS conference about this issue is that it's political suicide to even broach some of these issues. So the question is really, what can we do in the interim? And as I said before, I think that we need to really advocate for those organizations that are best placed to connect to these communities, to have the resources to do their work, to have the framework to do their work. Incredible work is being done even in the current legislative climate. In Trinidad, the Family Planning Association has done amazing work with migrant sex workers. In the Dominican Republic, COIN actually provides treatment for transgender people and are getting better outcomes for the transgender community than the public healthcare system. So let's see where these projects are working. Let's see how we can share those experiences and advocate for our governments to really prioritize these kinds of interventions as part of our commitment to health for all.
Thank you. And as because I want to be respectful of the time frame as well, but I want to close with these two questions. So one, I don't see any other hands or questions posted. Still feel free to type your questions in if you want. We'll respond afterwards and have those on the website. But I wanted to say, to put it out there, to try on, even as we look at targeting these subpopulations or key populations in terms of stigma, I think we have a significant amount of effort to change the views about whether it's HIV and, for me, also substance abuse and mental health, but change the general public norms and understanding about it. Because when you're going to the workplace and you are HIV positive, the folks who are your coworkers, who are your bosses, if they hold on to these stigma, that impacts you as an employee. And so I think, you know, looking for ways for employers to play a role in the kind of culture that they create around these topics is important as well. And I don't know if UNAIDS is working in that realm, but I'll transition to my next point. And not that we have to answer it now because we're kind of over time. But then also in this transition planning for the countries, thank you for even sharing that information with the countries that are actively working on that and those that are in the process. But is private industry at the table for these transition conversations? And for those on the line who may be in public health or not, how does the general community participate in that transition planning activity? How can they access, whether it's facilitated discussions, meetings, can contribute in writing? How can they participate in that process and move their government towards a kind of, you know, comprehensive transition plan?
I'll ask one of my coworkers to take that question.
And we'll wrap up after that answer. Can someone raise their hand if they're going to take on that particular question?
Maybe not.
Okay.
Food for thought.
Food for thought. Food for thought.
And I can get back to you, talk to my coworkers and get back to you about that question of how private sector is involved and how people could make inputs into the process. It's critical.
Okay. So I want to offer my thanks to you, Cedrienne, to your colleagues who are on the call, to all of the participants who made it on today. Again, this is the first. We will be reaching out regarding our violence discussion in August. And so, yeah, thanks again. And
thanks so much for participating. Yeah. And yeah, look out we will be sending out a recording of Cedrienne's presentation today and the presentation.
Yeah.
If y'all have any questions, feel free to reach out to Ryan and I, and we'll try to connect you to Cedrienne and her team at UNAIDS to answer any questions. But we hope that everyone on the line sees a role that they can play in getting involved in the HIV response in our countries, whether it's advocacy, writing letters, engaging in the dialogue around how do we ensure that we have enough funding to address this epidemic, And to get to zero, we don't need to have new HIV infections anymore. So how do we get to 0 new infections by 2030? What role do you play in getting us there? So I'll close with that.
I will be following up. You'll get a follow-up email for all participants with a quick survey just for your thoughts on this this webinar. And I'll have a link to the website where you can go ahead and access information for future webinars. And thanks again. Cedrienne, thank you.
And quick plug, Twitter, Facebook, UNAIDS Caribbean. You could connect with us and look out for our Global AIDS report next month.
Well, we're looking forward to that.
Appreciate it. Thank you. Thank you all. Have a good day.
Thank you.